Euthanasia, a research presentation by Naya Eni and Ellie May.
What you need to know about euthanasia.
Euthanasia is taking lives in a legal, medical, and painless way for a patient who is suffering from an incurable illness or irreversible coma.
Is euthanasia legal? Euthanasia is illegal in most countries, with the exceptions of Netherlands, Belgium, Colombia, Luxembourg, and Canada. However, there are other similar practices, such as physician-assisted suicide, which is legal in 9 states and Washington, D.C. in some form.
The different types of euthanasia. Voluntary euthanasia is when the patient is capable of and does not consent to it. Non-voluntary euthanasia is when the patient is incapable due to their condition to give consent, and therefore an appropriate person gives consent instead. Involuntary euthanasia is when the patient is capable of giving consent, but doesn't and still receives euthanasia, which is considered murder.
Passive versus active euthanasia. Passive euthanasia is when the patient isn't given necessary resources needed to remain alive. Passive euthanasia is legal everywhere in the U.S. Active euthanasia is when the patient is directly killed by lethal methods, either personally, which is physician-assisted suicide, or by a medical professional.
As of 2017, 73% of Americans support euthanasia. This graph demonstrates the percentages of Americans who support euthanasia from 1951 to 2017.
Should the intentional medical, painless, and consensual killing of a person who is stuck in a permanent coma or has an incurable disease be legal in the U.S.?
To answer this question, we must first consider who is affected when euthanasia happens.
Who is affected by euthanasia? The patient is affected by euthanasia because their life is taken, possibly without their knowledge. The doctor could also be affected because, despite the process being legal, it could take a toll on the doctor's conscience. The loved ones of the patient may also be affected because they might not be ready to see their loved one pass away. Communities might also be affected because, similar to the loved ones, the communities that the patient has been part of might not be ready to see the patient pass.
The pros of euthanasia. One pro for euthanasia is that it can end suffering because it can be very painful for the patient to wait out an impending death or the physical pain of their life-threatening condition. It could also avoid a waste of resources that are being used to keep the patient alive. For loved ones, it can make it easier for them to move on if the process follows quicker, as well as avoid the pain of a long wait for impending death. The idea of death with dignity is the idea that a person is allowed to decide how they die, and many people don't want the process to be as long and as painful as their situation causes.
The cons of euthanasia. One of the cons of euthanasia could be that the patient and their loved ones may not be ready yet for the patient to pass. Many people would also argue that the intention of ending any human life is immoral and wrong in any cause. Another con is that all doctors take the Hippocratic Oath that has existed for over 2,500 years, saying that they will never administer a deadly drug to anyone who has asked for it, nor will I make a suggestion to this effect. And the last con is that euthanasia may be against some religious beliefs.
Our opinions. I believe that only voluntary euthanasia should be legal, and perhaps some situations of non-voluntary euthanasia. With non-voluntary euthanasia, I think that there must be approval of full, immediate, sane adult family, including spouses, offspring, parents, and siblings, and must be performed by a willing and ready doctor.
I believe that euthanasia and non-voluntary euthanasia should be legal. However, for non-voluntary euthanasia, the family member giving consent must undergo several background checks and mental health checks. The patient receiving euthanasia should also receive several opinions from several different doctors about the state of their condition and whether recovery is possible or not.
In summary,
We both believe that euthanasia should be legal everywhere in the U.S. because of how much suffering it would be able to end for so many individuals. For the patients and families that do choose to use euthanasia, it would also save an immense amount of hospital resources, which can be used to treat and help a patient who does have a chance at recovery instead. And electricity-wise, can also make the hospital much more eco-friendly as well. This also not only allows an end to the patient's suffering, but allows them to die in a dignified and respectful way. Thank you.